Welcome to Real World, Real Talk with Dr. D.Z. Cofield. The show represents captivating conversations and insightful information to encourage and inspire you with all you need to become the best you can possibly be. And now, your host for Real World, Real Talk, Dr. D.Z. Cofield.
Good evening, everybody. Welcome to Real World, Real Talk. I'm your host, Dr. D.Z. Cofield, and you're listening on your member-supported public radio station, your number one source for jazz and more, KTSU 90.9 on the FM dial and KTSUradio.com and on the Real World, Real Talk podcast network. Man, I am excited to have you with us on today as we welcome back a familiar guest to talk about a subject that we have discussed before. But I'm excited to talk about this subject again because every time we talk about this subject, I get messages about how we have literally saved somebody's life, given somebody peace of mind, given somebody hope. And that's really what this show is all about, giving you the information that you need to become the best that you can possibly be. Because if you become the best you can possibly be, then the world will become the best place it can be. Just a couple of housekeeping matters before we get started. First of all, as you know, COVID-19 is still on the rise. We are seeing hospitalizations go up in some 30 plus states around the United States. And we're seeing deaths continue as well. And one of the challenges that we have in this country is when we think about, for example, COVID-19 cases rising in another state, there are no travel restrictions. So people are moving around our country relatively freely, whether they're flying or driving or taking a bus, whatever mode of transportation they're using. And so it's really a false sense of security when we feel like we're safe, for example, in Texas, and people are being infected and dying in Michigan, when the truth of the matter is there are people who are traveling from Michigan to Texas, people from Texas traveling to Michigan and coming back home, as just an example. And so it's important for us to recognize that we literally have to work together across this country. And while we have people who are protesting, who believe that being ordered to wear a mask is a violation of their civil liberties, and I'll be honest with you, I don't see it. If you do, then maybe you can help me to understand it. I really don't get it. You know, I go into a restaurant, I see a sign that says no shoes, no shirts, no service. If you ask mask and you say no shoes, no shirts, no mask, no service, you know, it is what it is. But at the end of the day, we should be working together to help suppress this virus. And now that we're going into flu season, it is clear that the majority of doctors are saying it's going to get worse before it gets better. So I hope you are well. I hope you're not one of the families who has lost a loved one during this tragic pandemic. If you are, our prayers and our well wishes go out to you, and let's make sure we minimize the number of deaths. If you haven't heard, the census has been extended to October the 31st, which was the original date. You remember the president announced that it was going to be shortened 30 days, and a court mandate ordered that it would go forward. And so you can still register for the census. It's not too late. All you need to do is go to my2020census.gov, my2020census.gov, and you can register for the census today and make sure you are counted. Vitally important for federal funding around schools, hospitals, roads, plays a role in our congressional redistricting and so many other things. And so it's really important that you register for the census. And early voting has started. It started October the 13th, and I want to encourage you to make sure you go out and vote and make sure your vote is counted. I'm seeing a lot of people who have made the decisions. They're not going to mail in their ballots. They don't trust the mail for whatever reason. So if you're not going to use, mail-in ballots, if you're not going to vote with absentee ballots, make sure you get out and vote. And I would suggest to you that you vote early instead of waiting until Election Day. We already know the lines on Election Day will be long. And while the lines are long to vote early, those lines tend to dissipate depending on the time of day. But if you wait until the last minute, something may happen, some tragedy may happen, some accident may happen, and you don't get to the poll. So make sure you do your part to vote early. I will have information for you. We had County Clerk Chris Hollins on, and he shared with us that there will be voting available 24 hours, 24-hour polling places. And so we'll be posting that information as well. So if, for example, maybe you work odd hours or you're not able to get to the poll, we want to give you that information as well. October is Breast Cancer Awareness Month. Breast Cancer Awareness Month. And it is really one of the most devastating diseases when it comes to the lives of women. Even though there's been a lot of progress that has been made, it still adversely affects women, and specifically women of color. And I want to encourage you through this show to take charge of your health. There's so many aspects to this, and we've gone through this subject matter several times. I've been really, really passionate about our whole pink campaign. We've been ending the year in the pink and encouraging women at the end of the year to get their mammograms done, begin the year in the pink. You know, we've really been pushing it. Interesting, it kind of threw me off a little bit because I always look forward to the National Football League players wearing their pink during the month of October. And now they're wearing this kind of multicolored, symbol. And so I understand now they're trying to raise awareness amongst all cancers, right? About all cancers. And so, they have pink in it and blue and green. I'm not even sure all the colors that are represented for the various kinds of cancer. And so I'm not sure if it's having the same impact or effect, but we'll see. But let's get ready to move forward. A couple of housekeeping matters just before we get started. If you'd like to follow me during the week, you can follow me on Instagram, on Twitter, and on Facebook at DZ Cofield. You can also follow me on the Real World Real Talk Podcast Network anywhere, RWRTDZ. That's RWRTDZ. I'm excited to welcome back to Real World Real Talk Dr. Jenny Bennett. Dr. Jenny Bennett is a friend of this station and a friend of mine. She is a native Houstonian. She earned her degrees, including her doctorate, from the University of Houston. She taught elementary, middle, undergraduate, and graduate studies and was the lead researcher for a mathematics project for the state of Louisiana and Texas Mathematics Professional Development Program. Dr. Bennett was elected and served on the board of directors for the world's largest mathematics organization, National Council of Teachers of Mathematics. Additionally, she was elected the president of another national mathematics organization, Benjamin Banneker Association. In addition to her leadership roles in mathematics, she has served as a Department of Defense Research Proposal Committee member as a breast cancer advocate. She also participates in cancer projects outside of the U.S. She serves on advocacy committees and research grants as a research advocate for breast cancer patients at MD Anderson Cancer Center. She did the first award-winning Making Cancer History commercial for MD Anderson and participated in the groundbreaking of the Mays Clinic Breast Center building for MD Anderson. As a result of her breast cancer diagnosis 24 years ago, Dr. Bennett started a nonprofit breast cancer organization, Reconstruction of a Survivor. And this organization has been in existence for 13 years. This organization provides free support group sessions for women diagnosed with breast cancer and their caregivers, family members, or friends. These sessions are led by trained facilitators who use a curriculum written by Dr. Bennett. There are currently 12 locations at hospitals and nonprofit organizations, including churches, and I'm privileged to host one of those groups at the Good Hope Missionary Baptist Church. We're also happy to have with us Jenny Kirkland. Jenny Kirkland joined Susan G. Komen Houston in 2010 in her role as the Senior Director of Community Programs and Partnerships. She oversees the community programs, including grant making, outreach, public policy, health equity, metastatic breast cancer program, and the Medical Advisory Council. She has over 20 years experience in conducting cancer intervention research, program planning, developing evaluation tools, coalition building, and training. She is a graduate of Texas A&M University and earned her master's degree from the University of Texas School of Public Health. She lives in Houston with a husband and two sons. Man, I am so excited to welcome to Real World, Real Talk, Dr. Jenny Bennett and Jenny Kirkland. Thank you all both for being with us today on Real World, Real Talk.
Thank you so much for having us.
Thank you.
Really excited. So Jenny Kirkland, Jenny Bennett is an old pro at this stuff, man. So we welcome you to this discussion. Let's start first of all with breast cancer awareness in general and why this is such an important subject. Jenny, you work for the Susan G. Komen Foundation, which has been one of the leading organizations in awareness and advocacy around breast cancer in this country. For somebody who may have been under a rock, over the last 25 years or more, can you give us a history of the Susan G. Komen Foundation, how it got started, and the work, the mission, and the vision of your organization?
Yes, thank you so much for having me. Komen Houston is celebrating its 30th anniversary this year. So it is not what we planned with the pandemic, but we still know the mission is so needed. We're discovering that people are not getting screened this year. And so we are so thankful for this interview, as well as other things we can do to encourage people to know that it is safe to get screened during pandemic. There's extra precautions that are being done right now. I got my mammogram yesterday, and I felt very safe with everyone wearing a mask and being socially distanced. And we are continuing this mission that we started over 30 years ago. Everything is started by a few people. And that's how Komen Houston started. Somebody called Dallas, and that's where our headquarters was and still is, and said, I want to bring Komen to Houston because we have a lot of unmet needs. And so that started the organization in Houston. And we had our first race in 1991. And then we had 3 grantees the first year, which was Baylor, MD Anderson, and the Rose. And that's at the heart of what we do, is to help women that are facing breast cancer with services if they're uninsured or underinsured or have barriers that maybe they're cultural barriers or financial barriers or rural barriers that make it harder for them to go get services. And so that's what we're trying to do. We also have a treatment assistance program that helps women that are in treatment. As you were mentioning earlier about people are facing problems with rent or paying for groceries during this time, or paying for a lymphedema sleeve, which is a side effect of breast cancer. And so our treatment assistance program will help women be able to afford those treatments. And that also helps women complete treatment. And that's one thing we want to see in all of those that are in treatment. Sometimes women don't complete treatment, and that leads to worse outcomes. And that's something we work hard to not have happen. And that's one way we work with our community grantees. Dr. Bennett's Reconstruction of a Survivor has been one of our community grantees for almost 10 years and is reaching women in breast cancer treatment, helping them complete treatment, helping them go beyond that and building their lives back again. Because as you know, this can be such a devastating disease. And we want to help women and men that get breast cancer be able to survive and thrive after a diagnosis.
Well, I tell you what, Jenny, on behalf of our community, I want to thank you for the work of Susan G. Komen. For those of you who are listening, I mentioned in the introduction, we were doing the end the year in the pink campaign and the begin the year in the pink campaign. And we were able to do that because of our partnership with the Texas Southern University School of Pharmacy, a grant that they received from the Susan G. Komen Foundation, specifically targeting minority women, African American women who did not have access to health care. And I can personally say I know of hundreds of women who were screened who didn't have health care, some of whom discovered lumps in that mobile mammogram unit and were referred and were able to get treatment. And so I want to thank you publicly for the work of Susan G. Komen to help change lives. And I would imagine you hear that a lot, but I would also imagine it never gets old hearing that, you saved somebody's life. And so that's absolutely tremendous, and we're grateful for the work. Dr. Bennett, you always serve as the producer of this show. So let me first start with Jenny. Why was it important for you this year to bring on Jenny Kirkland and the Susan G. Komen Foundation? In the past, we've had oncologists come on, and we've had breast cancer specialists. And so I always defer to you when it comes to this show. Why did you feel like it was important to bring Jenny on?
Well, thank you, Dr. Cofield, and I appreciate your willingness to inform the community. And oftentimes the community is not aware of other organizations such as Susan G. Komen, or they are aware of it, and that's their go-to. And so once we've been partnering with Komen. The main focus too that Komen has gone to now is the African American community, and a focus on an African American initiative. And we have our support groups in 11 or 12 different locations. And our one location that has only African American women is in Texas City. Galveston County has one of the highest rates of late-stage diagnosis of breast cancer and death in African American women. Not to say that Harris County doesn't either, or Brazoria County, but Galveston County is one of the highest, one of the areas that has the highest rate of deaths in African American women. So it's a lack of information. We provide educational sessions there in Galveston County. Of course, with COVID, we've not been able to do it. But we do have our support group in Texas City and at UTMB in Galveston County, as well as Harris County and Brazoria County. So it's important for me to bring them on to give a different perspective other than just having the specialist talk, because I can talk the language of the specialist, but Jenny can provide what's going on in the community beyond reconstruction of a survivor.
Yeah, that is true, Jenny. I got to tell you, we have the doctors on, and I'm not going to tell you how many times Dr. Bennett made, I'm not going to say correct the experts, but add to and supplement what they have to say. As we talk about breast cancer, where are we in the fight now? If you can give us kind of a status of where we are. We've seen, forms of breast cancer like triple negative DCI has come in and ravaging the African American community in particular. Where are we in the fight now?
Well, thank you again. We have come a long way in 30 years with the mortality rate definitely declining, but it's not declining at the same rate in all communities. And as Dr. Bennett mentioned, African American women in America are dying of breast cancer at unacceptable rates, and they're dying at more than 40% higher than the white women, their white neighbors. And we think just because of where you live or what you look like should not determine whether you live or die from breast cancer. And so we've had our grants program really look at the disparities with African American women in the last 5 years. And the grant that you mentioned with TSU is one of our great successes, where we really started a new program with a collaboration, and it really took off in the community. And it was wonderful to work with that group. They were all ears with different recommendation and different partnerships. So I hope we can continue to do that kind of work. And then specifically in Galveston, I mentioned 5 years ago, we did a big needs assessment to really see what was going on and to see what the needs of the community are. And we realized that's one of the communities we wanted to work in. And so we work together with community leaders that are boots on the ground, as well as those that are working for the oncology centers or the small clinics that are serving women maybe without insurance, and brought everyone together so we could all kind of march in the same way of counting what we want to be, measuring, what should we be measuring, how should we be measuring it, and doing it all together so we can show impact. And Dr. Bennett has been a key leader with that. And she has 2 support groups in Galveston, and one of them kind of was started around that same time and has really taken off and helped so many women, as well as the one that's been in League City for so many years has also taken off. And so we're really trying to collaborate, build trust, learn what's going on in the community, why we're seeing these statistics, what can we do, whether it's with patient navigation, with access to care, and with psychosocial support. And so empowering women, as you mentioned earlier, is so important, that they know that they can ask questions to their doctor, they can get a second opinion. Young women, especially African-American women, are at risk. And so we know African-American women get breast cancer at an earlier age. They're diagnosed with later stages and have more aggressive forms of the disease, like you talked about with triple negative. And one thing Komen is trying to do is to look at our research in a different way, where we're saying, let's look at those harder to treat cancers, the metastatic cancers, and that's how we're going to reduce this mortality that we're all trying to get at. So it takes a village, not just research, but community and, increasing access to care.
Yeah, I think it's so powerful to see the Susan G. Komen Foundation and other organizations to fight this disease and to recognize the worldwide effect that breast cancer is having. How are you all doing in terms of funding and making sure that, in the midst of COVID, and then, in the state of Texas specifically, 2.5 million people uninsured, underinsured, no change has been made by our state government. There have been moves to repeal the Affordable Care Act, not expand it. What are you seeing as some of the challenges to get people who are uninsured and underinsured, and people of color, people who are highly vulnerable, to get them into care?
This year is like no other, as you know. It really has been truly a huge test for nonprofits in the community. So we are doing things a little differently in the sense of working with some organizations to get the services out. And it is a unique situation in Texas because we didn't expand Medicaid several years ago, and that leaves more populations vulnerable. So we are trying to work at a policy level so we can improve access to care, bring more changes to policies so more women can get insurance, whether it's Medicaid or other types of insurance, so they can get care, and also empowering women to speak up and seek that care. And so that's one thing that, working with Reconstruction of a Survivor, we've done education events in Galveston and brought in speakers, but also brought in things that women like to do. It was before COVID, but it's the same thing I meant, and talking about the issues, because a lot of times maybe they aren't talked about. And so we encourage everyone to know their history and to ask what happened to their mother or their grandmother if there's a cancer diagnosis, so everyone knows that and then they can talk to their doctor about what their risk is.
Dr. Cofield, also you mentioned the fact that there's a lump. And oftentimes there's a misconception that it's only going to be a lump. Many times women have dense breasts. And so with that meaning the tissue is more closely compact than one who does not have dense breasts. So it's easier. It makes it more difficult to detect a breast cancer with dense breast unless you have a 3D mammogram. The other thing is that the misconception or myth is you only have to have a lump. And that's not the case. You can have a nipple discharge, you can have an inverted nipple, or you can have a rash. And that rash is something that women need to be very careful about, because oftentimes they run to the dermatologist, and the dermatologist misdiagnosed that rash on the breast, in the breast area, or under the arm. And it's more than that. You know, I've heard women who've had inflammatory breast cancer, which is the rash, to say, you know, my doctor told me, and this is African-American women, and one white woman who's been on a support group. He told me that it was an allergic reaction to my deodorant. And that's not the case. So I really want the general public to understand you have to know your body. No one knows your body but you. And if you feel in your spirit that you need to get another opinion, go do so. If you have insurance, your insurance will pay for it. By law, they have to in Texas and other states. And if you don't have insurance, there are ways that you can get that financed.
You know, Dr. Bennett, I was going to ask you, because it's amazing. Reconstruction of a Survivor does a tremendous job of supporting women who have been diagnosed, but you're also an advocate and an activist on the front end of this. Yes. In terms of helping people and women to identify those issues. What are some of the challenges that you're facing and finding now in the midst of this pandemic, in terms of just encouraging women, again, to make sure they stay on top of the physical changes that they're going through? Because so much is going on, and I think all of us are dealing with a level of global grief. And you know, the typical modes of self-care that most people have created, you know, they can't do anymore if they have anything to do with socializing with other people and going places and things like that. What are some of the things that you're telling your survivors and you're telling women on the front end that they need to do through this pandemic? Because one of the things I've been really pressing with all of our health and wellness shows is to let people know that with the presence of COVID, other diseases haven't disappeared. They're still here. And so whether it's heart disease or diabetes or cancer, whatever it is, they're still here with us, and we still have to fight that fight.
And that's a good question, because COVID has changed a lot in our lives, in our everyday life. And the main thing that we try to enforce with the ladies during COVID, number one, we still have our support groups. We were meeting face to face. Now we're on Zoom. So that helps them to know that there's still someone there for them as they go through the journey. The other thing with the fact that women are still being diagnosed every single day with breast cancer. I mean, every day. And we're here for them. As Jenny mentioned, we do provide an educational session, and we were planning on spreading that to Harris County. However, COVID hit, and we had to forego those plans. Hopefully, when this pandemic disappears or ceases, then what we're planning on doing is doing one, and not just in Galveston County, but in Harris County. The other thing that we encourage women to do who've been diagnosed is to go to treatment. We had one lady a couple of years ago, who was diagnosed with stage 4 breast cancer. She would come to our support group meetings when we were meeting face to face. She wouldn't go to treatment because she was homeless and sleeping on the streets. And I think that's a population that we tend to forget about, because they are susceptible to cancers as well, even during this time. And she said, I'm not going, because if I go to treatment, then I have to go back and sleep on the streets with the animals and with the elements. And I cannot, if I get sick, then there's no one to help me. So we put her in an extended stay hotel in order for her to go to treatment. And she did, but she didn't make it because the cancer had spread everywhere in her body. So she didn't make it. But again, it's so important for us to encourage them. We had one young lady who was 26 years old when she was diagnosed, Antonia. And Antonia said, I had a lump. I ignored it because I thought it would go away. And I said, Antonia, you thought what? She said, I thought it would go away. And it didn't. It kept getting larger and larger and larger. She said, I finally decided. She works for a hospital system in the medical center. And she said, I finally decided to go get it checked out. And it was stage 3. There are only 4 stages of cancer, and hers was stage 3, which meant that the adjuvant therapy that she needed was more rigorous than what I had when I was diagnosed. So the COVID has really cause people to rethink their health and what's important. Of course, we know that most oftentimes people think shelter and food, but also your health. And as women, particularly African American women, we tend to take care of everybody else but ourselves. And that's something that we have to really rethink.
I think what's interesting to me is many of us, and some who may be listening, some who may not be listening, don't understand the wide-ranging impact that breast cancer has when it comes to our families, right? It's not just our wives, it's our mothers, it's our aunts, it's our sisters, and then just the rippling effect that the disease has on the entire family. What are you seeing that you're facing now as you deal with not just the physical, and you alluded to it earlier, but the emotional strain that it's putting on your survivors? As we're walking through this pandemic, Michelle Obama talked about the low-grade depression that she feels like she's going through. And I don't know if it's low grade, mid grade, or high grade. I think everybody though is dealing with a level of depression, one way or another. How are you all shifting your support? What are you all doing to address that additional depression and stress that people are dealing with?
Well, I'm glad you asked that question, Dr. Cofield, because our curriculum does address, it's okay to cry is one of our sessions. I Will Forgive is another session in the curriculum. And because our curriculum does address those things that are challenges for the patients as well as their caregivers and families, but we have trained facilitators, and they did a writing session, which was think about some positive aspects of your diagnosis of breast cancer during this COVID time. What are you doing that's going to change things in your life? What has changed in your life that you can get a handle of and what you can't get a handle on? So we've addressed those sessions with also having persons come in and to talk about and train our facilitators. How do you handle your attendees during this time? We had a training session a few months ago for the facilitators, and she specifically talked about during the pandemic what you can do with the survivors in your group as well as the families. How do you address that? How can they talk to the families? What services do they need beyond the support group? Because our support groups address physical, emotional, and spiritual well-being. Because, as you know, the churches are not in session right now where people can make face-to-face, feel good about themselves, as well as to know spiritually their needs are met. They're getting fed. So even though they're still getting fed through our support groups virtually, they seem to get more out of the face-to-face. For whatever reason, it's the socialization that women are missing. Zoom does not do it all. So we try to give them enthusiasm by the session topics that we cover, but also additionally beyond that, having guest speakers to come in and talk about the social workers. We have a couple of social workers who conduct the sessions for us, who are one is a survivor and one is not. But they know the aspects of what this pandemic has done because they're in the field. So we try to make sure that all of the sessions in all of our locations do address the needs of the survivors and their families during this time.
Yeah, I think that's absolutely amazing because, as you said, everyone is impacted by this, and
yes,
it's true. Zoom is not the end all. I think for some of us who may be more introverted, we're better suited on Zoom. But, people are going through Zoom fatigue right now, because, they're Zooming on the job, they're Zooming, for the hospital, telemed. I mean, our children are about Zoomed out. And so it's a challenge. I mean, and these new opportunities and new vehicles also are presenting new challenges. Jenny, what are you looking to do? What is Komen looking to do to make the best out of this new situation, called the virtual digital world that we live in? What are some of the strategies that you all are looking at, and how can we help spread that word?
Sure. Well, one thing, we've been focusing on in the last few years is patients with metastatic breast cancer, which means the breast cancer has spread outside of the breast. And so those ladies and men are always going to be in treatment, which, and oftentimes they feel isolated because they're not the survivors that are done with treatment after a few years and can get back into their lives. They're always going to be having a scan, looking at treatments, maybe starting a new treatment, getting a second opinion. And so we were lucky to have our metastatic breast cancer conference in February, right before everything got really crazy with the pandemic starting in March. But one thing we can do now is to have our patients that were in our community join these virtual meetings across the country. And so they can get a sampling of different topics from different other Komen activities. And so that's one thing that has come out of this is we can share activities a lot better nowadays than we were before. Just we're doing kind of the in-person events. And we are really getting good at Zooming and having virtual events. It's not the same, but we are trying to meet people where they're at. And also partnering with organizations, because we don't have to do it all. We can partner with organizations that are reaching these patients and provide support. So that's one thing we're looking at. We just had our 30th Race for the Cure. It was virtual the first weekend on October. So it was great to still be with friends and family at a smaller scale and celebrating where you are, racing where you are. So we are changing. We also know that events aren't going to bring in the funding that we have historically had from these funds, from these events. And so we need to look at other strategies and look at those and, individual giving or other things, and having direct services also helps us reach patients in a different way. We have a patient navigator on our team that has definitely helped women before the pandemic, but also women that have a lump right now and need to get care and are feeling unsure of where to go. So that's one strategy too, is just really having some more direct services, still working with our grantees, but doing those kind of individual touches that we know we can make a difference in their lives and connecting them to care.
Dr. Cofield, let me also add too that some women have lost their employment. And they feel that, they've noticed a change within their breasts and say, okay, there's a change, but I don't have any money. I don't have any insurance. What can I do? So in the greater Houston area, we've got the Rose. The Rose will take care of them for diagnostic services. If you work part-time or full-time still and don't have insurance, then the Rose will charge you a fee, a sliding scale fee for a mammogram and ultrasound. If the person doesn't have any insurance at all, so whatever, and meet a certain poverty level, then the Rose will do it at no cost. However, you have to have what's called a referral. And Dr. Sean Burton of the Magnolia Family Medical Center will do a breast self-exam, a clinical breast exam for the person with the minimum charge. If the person has a positive diagnosis, we have fought years ago for this federal funding called the Breast and Cervical Cancer Services Program. That takes care of payments for every single thing if you have absolutely no insurance, from diagnosis to treatments such as surgery, chemotherapy, radiation, as well as oral medication following surgery and what have you. So oftentimes women are not aware of these services because of the fact that no one talks about it. No one tells them because even the doctors don't even know. So therefore, they have to rely on an organization like Komen and Reconstruction of a Survivor for such information as this.
I think that's absolutely tremendous because, I can only imagine, a woman, for example, who has been diagnosed, who has been furloughed, and lost her insurance, just trying to figure out now, okay, how do I eat? How do I pay bills? How do I stay in my apartment or my home, along with how do I stay in treatment? And none of those things, none of those stressors are disease friendly. And so it's really, really important. Jenny, talk about some of the partnerships. You talked earlier and referred to one of the partnerships that we have participated in, the Texas Southern University School of Pharmacy. Had a tremendous program, and man, those young people did an absolutely tremendous job in targeting communities that were underserved, reaching out to communities that did not have access to health care. Some who were just completely ignorant, to Dr. Bennett's point, just didn't know what was out there, didn't know, it was still, I think there are many people who still brag, I know in our community, about having never been to a doctor. And, as long as they are functioning, they feel like they're good. But can you talk some about the partnerships that are out there specifically that Susan G. Komen and the foundation support? Because I'm sure there are people who call you all thinking you're a medical facility and and want to talk to the doctors and how they can get treatment, and you don't provide direct treatment, but you partner with agencies and doctors who do.
Yes, thank you. Well, another one of our successful partnerships has been with the Harris Health System. And, that is our safety net hospital, as well as, the clinics that provide services to men and women in Harris County. And we have funded them for probably almost 25 years, but most recently in the last 10 years, we have funded their patient navigation program. And in the last 5 years, it's really focused on African American women because they are at a higher risk for not getting a mammogram in that system. And so right now we have one navigator, and the objective there is really to call those women that are rarely or never screened. So they're already getting care in the system, they're already patients in the system, but for whatever reason, they have not gotten their mammogram in the last 2 to 3 years. And so the navigator is calling and using motivational interviewing tactics, as well as helping reduce barriers. Maybe there's some really physical barriers to getting a mammogram, whether they need to be closer to a bus line to get a mammogram, or they need a bus token, or they need a certain day to see their doctor. And so that is one program that we've been doing. And so they get a list from Harris Health on who hasn't gotten a mammogram, and they're the African American women. We're targeting those women, and they're calling those patients. And they've helped women get a mammogram from that. And the other part of that program also used to target clinics that had a higher percent of African American women, and helping remind them when their appointment is, and helping them rearrange their schedule if something comes up and they can't make it. And that program has reduced the no-show rate, which was at 40% when you don't do any calls, to less than 10%. And that means you can see more patients, you can save money by having an efficient program, and you can do more mammograms when you are able to reduce the no-show rate to 10%. And that's about the same no-show rate that many for-profit clinics have. So that's a really great success. That program also does outreach and works with Baylor College of Medicine with a program where they are targeting, whether it's with churches or other community groups, to talk about the breast cancer and how you get help if you have any signs and symptoms. And that has been a great partnership, too, with Harris Health and Baylor and the Komen grant of working together and doing a monologue for many years, reaching those target communities. And so the patient navigator would go to those events and let people know about the services of Harris Health. So it's kind of a multi-prong approach to trying to increase breast cancer screening, getting people in earlier, especially in the African American community. And we're really proud of that partnership and hope we can continue to do those kind of successful programs.
And also, Jenny, I might want to mention that we have been in Galveston County in particular. We have, through our Partners in Pink group that we have there, is a conglomeration of several organizations within the Galveston County area. And one of the partnerships that's really unusual is HEB. And at HEB, once a month, before the pandemic started, we've been doing this for about a year now. where one of our facilitators at our support group will go on a Saturday, and they have what's called a health day once a month at HEB in Galveston County. And they would talk to women about getting their mammograms, sign up women even to go get a mammogram. And I think that's really critical because it looks at a different community partner that we have other than just the normal, the church, our school or what have you. But partnering with the grocery store is really, really important. And I think that's something that we should look at in other areas within the Coleman 7 County area.
What has made that partnership so unique, Dr. Bennett?
The fact that we have a person in fact, Pat Jones is metastatic. Her cancer is elsewhere other than just her breast, and she's a go-getter. But what's made it important because she is surviving breast cancer and thriving with it, and the fact that she's walked that road of making sure that people get their mammograms. Even she does this at her church, and because she's in a missionary Baptist, I think she's a missionary Baptist church. The sisters, the nurses there, want to get together and do something again once we get rid of this pandemic. But it's been so successful, I think, because of her fact that she is a breast cancer survivor and is thriving and living with breast cancer. And I think that's so important because if you have someone who is walking that walk, it's easy for them to explain to someone who's never walked that walk to, please take care of yourself. And I think that's what's really important about the fact that we're partnering with HEB and she's there on a Saturday.
Yeah. I think, Dr. Bennett, one of the things that I've learned in this process is, how deadly ignorance can be. And when I say ignorance, I'm not talking about it in a pejorative way. I'm just talking about people not knowing.
Right.
And, we've had events here at the church, and I've literally had women walk out in their 60s who said, man, thank you so much. I always heard I needed to feel for a lump, but I never knew what it felt like. But I was able to come today, and now I know what I'm feeling for. Like, I'm not just feeling in the blind. I know what it's supposed to feel like. I know how to do a self-exam now. And those kinds of events are always powerful to me because knowledge is power. And whenever we can give out information and specific information, it can be life-changing. Are there any plans to do any, and I know there are logistics to work through with digital platforms, but are there any plans to do any very specific things on the social media side or on the digital platform, basic information that we can get out? And I know there's challenges with COVID. I'm just wondering if there's been any thought given to that. Dr. Bennett, Jenny, either one of you.
Jenny, go ahead. Yeah, I'll let you start.
Okay. We're definitely trying to make sure that women know to get a mammogram in various ways. Right now, we just posted a video from Dr. Angelica Robinson, who is she's over breast imaging at UTMB, and they've taken so many precautions. And as you mentioned, I think during one of the months in the pandemic, breast cancer diagnosis was down by 50%. That doesn't mean there's not breast cancer anymore. It just means there's going to be a delay in finding them. So we definitely want to make sure women are getting back to it. At the beginning of the pandemic, we also really tried to get out in front of the patients about the new normal and what to expect, because we don't want women or men feeling fearful that they can't see their healthcare provider. And so the Coalition Partners in Pink created a fact sheet that can help you when you're making your appointment. What steps am I going to go through when I get to the center? Do I need to have a COVID test before I come? Can someone come in with me? And it helps the patient feel reassured about next steps when they're going to get health care. So that's one thing that we've come up with. Coleman headquarters came up with like a telehealth checklist. So you're ready for your telehealth appointment. I've done telehealth during this time. And you definitely kind of have to get in a different mindset, make sure you are in a quiet space, make sure you have the internet, all these different things that we haven't had to do before. And I think telehealth has been a great new addition that's come out of the COVID experience. And I hope those can be, that kind of technology can be used moving forward, because it does make it easy to see your doctor once you're used to it. So we're definitely trying to adjust to the new normal. Dr. Bennett, do you want to talk about what you've been doing?
Yes. One of the things what we have been doing has been, my daughter Melissa takes care of our social media. People have been on social media like crazy recently since the pandemic, even more so since the pandemic started. And so we're on Instagram and also on Facebook. And on those platforms, she's been posting facts for women to know about getting mammograms, knowing that if there's a difference in your breast. Also, where do you go to get help? Stories about some of the persons who are in our support groups who share their story about when they were diagnosed, what lessons I've learned from being diagnosed with breast cancer. So we've used social media platforms. Again, we're still trying to work out how do we get the education piece done without having people come face to face, because we do a special education session rather. It makes it very difficult because we can't do it face to face right now. Even with social distancing, it's still going to be kind of difficult to get everything taken care of. So it's still a learning curve that we're all adjusting to, but I know it's going to work out for the community.
Well, I'm certainly grateful and thankful for the time that you ladies have taken to raise awareness around this issue, to remind us that this is still a fight that's going on. We can't divert all of the medical troops to COVID-19 because we still have a lot of devastating diseases that are out there that are taking the lives of people, including breast cancer. Jenny, what are some final thoughts that you'd like to share today?
I think we've all learned a lot during this time, and there's more resources available. The Komen Treatment Assistance that's available through 1-877-GO-KOMEN. Dr. Bennett has assistance programs, so we're really definitely trying to meet the needs and making sure women feel comfortable to get screened or seek support if they have a lump.
All right, Dr. Bennett, what would you like to share as we close out?
I'd like to share, when I was diagnosed 24 years ago, the technology is not the same as it is today. It's really increased, even for the different therapies. As you mentioned earlier, I serve on the committee for reviewing grant proposals for the Department of Defense, which is a federal grant through the Army, Division of the Army. And what we do is I look at the different types of new innovations that are coming forth and technologies coming forth with breast cancer diagnosis. So it's not hopeless. You may think it's hopeless. I know I thought I was going to die when I was first diagnosed, but I went from hopelessness to hope. And by the fact that I wrote the curriculum for the support group, and that's what gave me the hope. So there is always hope, and we're here for anyone, any ethnicity, any religious background, or any socioeconomic level. We are here for you as a nonprofit breast cancer organization.
Well, let me say thank you to both of you ladies for the work that you do. And Jenny, we really appreciate the Susan G. Komen organization and the work that you've done over the last 30 years. Dr. Bennett, thank you again for your friendship, and thank you for the work that you're doing on the ground as well. The late Vernon John said, if you see a good fight, get in it. And I always add, if you don't see a good fight, start one. And the fight for your personal health is a fight that you definitely want to not just begin, but you want to stay engaged in. I've heard a lot of people joke, including myself, about the COVID weight that I've gained and some of the COVID activities that people are participating in that may not be the most healthy activities, including not going to the doctor, not staying in touch with your primary care physician, not keeping those regular appointments that you would normally take. And so I want to encourage you to, if at all possible, experience a reset, to recognize that no matter how long this pandemic lasts, your health is something that you should be concerned about on an ongoing basis. And so if you have been diagnosed with an illness, don't abandon your treatment. Make sure you re-engage with your treatment if you have put it on the side. And if you are suspecting that you may have a health challenge, make sure you do your part. Go see your doctor, whether it's a doctor, a specialist, a dentist, whoever it is. They have COVID protocols in place. You can go get your checkup. You can go get your treatment and continue that fight. We won't be in COVID always. Make sure you do your part to stay healthy. This is Dr. DZ Cofield for Real World, Real Talk, signing off. And those of you who are on the KTSU network, get ready for truth. Until next week, take care. That's my prayer. All right? Bye-bye.
Thanks for listening to this episode of Real World, Real Talk. Be sure to subscribe to this podcast to be notified of new episodes every week. Follow us via social media using the @RWRTDZ username on all platforms: YouTube, Facebook, Instagram, and Twitter. To submit any comments, questions, sponsor opportunities, or future show suggestions, visit us online at rwrtdz.com or via email at info@rwrtdz.com. Thank you for listening, and we hope you've been inspired to be the change you want to see in the world today. Until next time, be real, keep it real, and stay real.